Good morning, everyone, and welcome to the regular meeting of the Multnomah County Board of Commissioners. Audience members, I want to start by asking you to please silence your electronic devices. I also would like to remind you that in addition to the audience in this room, we have people watching and listening online, so please consider your words and comments and testimony today. Today's meeting is a hybrid board meeting. Some presenters and guests will appear in person and some will appear virtually. For those presenting virtually, please mute your mic when you're not speaking, and when presenting, make sure to unmute your mic and turn on your camera. For those joining us in person to provide public testimony or to present, please turn your mic on when you begin speaking so the green light is showing, and off when you've completed your remarks so the red light is showing. For all presenters, please state your name for the record before speaking or responding to questions. And I just did want to note that Commissioner Jones-Dickson is online virtually for the beginning of the meeting. May I have a motion on the consent calendar? Commissioner Singleton moves. Commissioner Brim-Edwards seconds. Approval of the consent calendar. All those in favor, please say aye. 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 The consent calendar is approved.
Opportunity for public comment on non-agenda matters. This is a time for the board to hear public testimony, not for board deliberation. When it is your turn to speak, I will call your name and or unmute you and call you to the presenters table. I will set a timer for 3 minutes when you begin speaking and announce when your time is up, at which point please wrap up your sentence. We have 5 people signed up for verbal testimony and received 2 written testimonies which were shared with board members and staff. I'm going to call down first Anna Azizkhani, Janice Then, Kevin Oakley, and Ruth Ann Galicia Lopez.
Hi, good morning. You can go and begin when you're ready.
Okay. All right. Good morning. I'm Janice Then, a volunteer at Multnomah County Animal Services, and I'm here to talk about Gingerbread Man, who was a 60-pound, 3-year-old white tan pit bull. He was found as a stray on 12/3. His initial exam, he was described as having low FAS, fear, anxiety, stress, easy to leash, social, soliciting attention, strong, and enthusiastic. After a week in the shelter, he started showing signs of kennel stress, getting reactive to other dogs, pacing, panting heavily, with significant drooling. He was noted to now have high FAS and put on behavior meds. His notes indicate the following days are positive, describing him as having 0 handling sensitivities, a loose body, walking well on a leash, accepting pets all over, and displaying 0 jumpiness or mouthiness. By the second week, he started to lose weight. His ribs were visible. He got kennel cough. He continued to lose weight. His kennel cough symptoms got worse, and his kennel stress heightened. By December 23rd, he had deteriorated to the point that he was jumping, barking, fence fighting. His behavior meds were increased. By January 6th, his 5th week of sitting at the shelter, he was still exhibiting high levels of FAS with barking, drooling, panting. He was leash biting, but the handlers were able to distract him with cheese, and volunteers figured out that he was much more calm when carrying around a stuffed animal in his mouth. Rounds met and put him on hold, meaning no opportunity to get adopted. He sat that way for 10 days as he continued to deteriorate, but his behavior notes state that either his leash biting was easily redirected or he did not exhibit any negative behaviors when leashing or handling. On the 15th, he was neutered. The following days showed success in using treats and stuffies to keep him from jumping or mouthing. On the 20th of January, a volunteer wrote, "I was unable to enter the kennel without the dog grabbing the leash and my gloves, unable to get a leash on him without mouthing. Decided not to walk this dog. As a volunteer there for almost 10 years, I would not have walked into that kennel with a jumpy, mouthy dog. I would have cracked the door, put my leash in, and taken him out." He was subsequently taken back off adoptions, and his fate was sealed. Despite positive notes for the following week, that said he never got jumpy or mouthy. He was soliciting pets all over and listening well to commands. Rounds met on 1:30 and decided to euthanize due to hyper-compulsive and high-intensity jumpy mouthy behavior, and he was killed on the 31st. Kennel stress is an emotional response.
Thank you, and I know you have written testimony, so if you can share it with the board clerk, we'll make sure that it gets distributed to everyone. Thank you. Good morning.
Hi, my name is Anna, and I'm here to talk about Multnomah County Animal Services. I've been here many times over the past year and a half, and I've told you about the lack of a medical director and the inadequate medical staff, which led to Thor, Jade, and Winnie going untreated for kennel cough and developing life-threatening pneumonia. Winnie was euthanized for it. I told you about Meatball, who was vomiting off and on for weeks before he was finally seen by a vet, then euthanized. I've told you about non-vets diagnosing conditions and prescribing medications, which violates Oregon veterinary law and puts these animals in danger. I've told you about the over $700,000 in Dolly's fund that does not get used for medical treatments. Instead, dogs get euthanized for treatable conditions. I've told you about Crumble and Noelle, 2 puppies euthanized for puppy behaviors. I have told you how there used to be trainers who would help adopters and volunteers and a behaviorist who would be consulted for behavior cases. Now dogs are getting euthanized because adopters, volunteers, and fosters do not know how to properly let dogs decompress nor manage regular dog behaviors. The public believes that MCAS only euthanizes untreatable and aggressive dogs. I have presented how that is false. But today I'm here to tell you about Bruce, a 50-pound, 3-year-old pit bull mix who came into the shelter on January 10. He was described as scared, but a gentle and affectionate dog who enjoyed all contact, closing his eyes and stretching out his neck as the handler gave pets between his eyes. His foster described him as very people social, eager to please, able to cohabitate with dogs and new people easily, sweet, cuddly, and loves to be carried. On January 24th, he was neutered. On January 25th, at 7:59 a.m., a certified vet tech, a CVT, wrote he was crouching and shy and to continue to monitor. At 2:49 p.m. that same day, he was checked on again, but only because a volunteer reported that he was lying still in his kennel with bloody drool. A different CVT came out, not a vet, and observed Bruce sitting leaned up against the wall with strands of reddish drool under his chin, a few small areas on the floor with pink-red watery vomit. What would you do if you saw your dog like that? I'm sure you would rush to the emergency vet. But this vet tech prescribed an anti-nausea medication, wrote to recheck in the morning, which was 15 hours later, and alert the vet if no improvement. The next morning, January 26th at 7:21 a.m., Bruce was found dead in his kennel, bleeding from the mouth with foamy blood-tinged discharge from his nose. Blood was in multiple spots on the kennel floor. Why was the vet not alerted right away? Why did a volunteer need to bring this to the attention of animal health? Why was he not taken to Dove Lewis using Dolly's fund? Why do non-vets continue to make diagnoses and prescribe medications? Why is the healthcare of animals at MCAS like this? This is medical negligence, not even close to meeting the accepted standard of care. We want the vet tech, Clarissa Payton, and Andrew Matthias, the shelter manager, to be held accountable. I just want to say one other thing. I noticed that Director Grayheck is here. I just want to say—
Thank you. Your time is up.
We're not your enemies. Please meet with us. We want the shelter to thrive. We want to have a shelter that we can all be proud of.
Thank you.
Next up, we have Lightning.
Good morning.
Good morning. My name is Lightning. I represent Lightning Super, We the People for All the People. These volunteers should be given awards for their efforts that they're making to save the animals. And again, real fast from my position, I do want to have a pet chaplain, animal chaplain, full-time hired, that overlooks any and all euthanasias and communicates with everybody basically on that issue. Now, moving to another issue is, I think President Trump is just you know, in the terms of the fighting world, it just acts like a lightweight. And the reality is why I'm saying that to you, President Trump, is that you're putting on that White House card for the UFC fighters. And as we know in Oregon from Team Quest, we had Dan Henderson, we had Randy Couture, we had some of the best fighters in the world. And you could basically go 20 minutes and shake their hand at that facility in the world. And what I'm saying to President Trump, I think you're still a little mad at Dana White for buying UFC at $2 million and then selling it for about $5 million, and now it's worth about $14 million after their Paramount contract. I'm asking you, President Trump, to step up for once in your life, get out of your chair, and put on a fight against Dana White. I want these UFC fighters to be paid the most in their lifetime on that White House card. And what I'm asking you to do is, on a finished bonus that they'll be paid on these fights in front of the White House, I want you to talk to Mark Zuckerberg, Elon Musk, and various other people. I want to have at a minimum $250 million to be placed upon all these fighters on the finished fights. Quit acting like a lightweight. Quit getting pushed around by Dana White. And by the way, Dana, if you got a problem with what I'm saying, come to Portland, Oregon, and me and you will settle it out on the street. Tough, Dana. And let me say this to you. You have no ability to bring that kind of money to the table. President Trump can do it with a couple phone calls. These fighters will make the most money in their lifetimes on that fight to celebrate the 250th anniversary. And all my good friends, the UFC fighters, if any of you have a problem with me wanting to see you get the biggest payday of your lifetimes, come into Portland, Oregon, and we'll settle it at Team Quest. Any of you. Because I don't think any of you are even going to challenge me on that. So anyway, to President Trump, get out of your chair, quit sleeping behind your desk, and get this taken care of. Do not be afraid of Dana White. He's not that tough.
Thank you.
That's all the public testimony that we have, and so we can move on to R1.
Thank you.
Multnomah County Animal Services Board resolution related to MCAS fees.
Commissioner Bram Edwards moves, Commissioner Singleton seconds approval of R1. So appreciate the work that has been done by DCS and MCAS around the fees and this resolution related to updating and modernizing what's in there. I wanted to also pass it over to Commissioner Bram Edwards, who has some opening remarks as well.
Great, thank you, Chair. So colleagues, this morning we're receiving the presentation follow-up to the animal fee study that was sent to our offices this fall. I sponsored this budget note. Good morning. This budget note last spring after discovering that Animal Services has not adjusted fees since 2019, and a fee study apparently has not occurred for quite some time. I'm looking forward to the presentation today, and I think it's important foundational information for the Commission to weigh as we head into budget development. The key, as we will hear, the fee study is comprehensive and includes pet and facility licensing fees and boarding and adoption fees. It also points to an issue, very low compliance with licensing of pets, where the county should focus some attention. I know already some thought has been given to that particular issue. And so I'm just going to also actually provide just a public service announcement. So the reminder to all the pet owners, you know who you are. In Multnomah County, your pet must be licensed and licensing must be renewed. There are options for 1, 2, or 3-year licensing, and that can be done online. So with that, I'm going to thank Director Badway and Director Grech for their teams for conducting and sending this fee study for us. I think it gives us some great information for us as we move ahead and look at ways in which we can support Multnomah County's animal shelter.
Great,
And
thank
animal
you.
services.
Thank you, Commissioner. Good morning. My name is Margie Bradway. I am the DCS Director. I go by she, hers. Thank you for having this on this fee study. This is one of 3 comprehensive fee studies that DCS has done this year, and I think these fee studies, they take a lot of work and a lot of time, but I think it's really important if you look across the different sectors that we've done fee studies, we've come to some very different findings and recommendations, and so that's why it's so important to do the research and take your time. Speaking of research, I want to recognize a few people. We have our lead researcher, Audubon Paul. Thank you very much. We have Jay, who did an incredible amount of work. And then we also have our attorney here today, Veronica Rodriguez, who's extremely helpful in putting the resolution together. And she actually drafted the resolution, and that's really important because there is an action before you today. And that action is to really clean up our code, and Director Grayheck will go into that a little bit on the why. So at the end of this presentation, we'll be asking you for a vote. So with no further ado, I will hand it off to MCAS Director Grayheck.
Good morning. Good morning, Chair Vega-Peterson and Commissioners, and thank you, Margie. For the record, my name is Erin Grayheck. I use she and her for my pronouns, and I'm the Director of Multnomah County Animal Services. We're here today to review the findings and recommendations from our MCAS fee study and to present a resolution to the board to update our fees in the county code. Next slide, please. Specifically this morning, I would like to highlight key elements of our fee study and some specific recommendations that arose out of that study, including a resolution before the board to update Chapter 13 of County Code as it relates to MCAS fees, and finally to take any questions that you may have related to the fee study and the proposed resolution. Next slide, please. In July of 2025, in Budget Note number 8, the board directed MCAS to engage in an intentional study of our current fee structure in order to determine percentage of cost recovery through current fees, as well as comparing our fees to comparable jurisdictions. Our fee study looked at a 5-year period of data from fiscal year 2021 to fiscal year 2025. We looked at administrative fees related to licensing and adoptions. Next slide, please. You will see on this slide that there is some variability in our licensing and adoption fees relative to other Oregon counties and cities. And over the next couple of slides, I'll share our recommendations in these areas as reflected in the fee study. Next slide, please. While few jurisdictions publish their pet license compliance rate, one basic standard, according to a leading pet license service provider, is for a 20% compliance rate as a baseline. A model jurisdiction in Calgary, Alberta, which centers licensing as a core component of responsible pet ownership and a pet's ticket to home if they ever get lost. The city conducts extensive outreach, offers incentives, and boasts a high license compliance rate, setting a benchmark for what is possible. We've estimated our compliance rates based on a number of active licenses compared against the American Veterinary Medical Association's pet ownership and demographic sourcebook data, and the Multnomah County Census for number of households. There are important opportunities to raise license compliance to a healthy rate by industry standards, and so that would be greater than 20%, and increase revenue by volume in that process. Next slide, please. We've elected to consider these 4 areas: equity, public health considerations, importance of reunification, and progressive animal welfare approaches as we reviewed our findings and crafted our recommendations for change to our fee structure and subsequent changes to Chapter 13 of County Code. From an equity perspective, we considered how to make pet ownership accessible across many communities and income standards. Licensing is critical for our ability to track rabies vaccine compliance, and this is an important public health issue. and a place where we partner with the health department. Pet reunification is the most desirable path for a pet to leave the shelter. We always have a goal of centering the pet and human and animal bond. And licensing is a great tool to help a lost pet find their human, or to have us find that human for them. Progressive animal welfare approaches suggest that reducing barriers to reunification by eliminating impound fees is a best practice. Next slide, please. After a review of our findings, MCAS shared 4 key recommendations in the report that we sent to the board in September. They are licensing, adoptions, impound and boarding, and administrative cleanup. I'll review these over the next few slides. Next slide, please. When we look at licensing, the data tells a clear story. We don't have a pricing problem, we have a participation problem. Our dog license fees are already higher than the median for similar metropolitan areas, so raising them further would likely be counterproductive. Keeping fees accessible will also meet our goals to promote pet license compliance in the interest of pet reunification and public health for the rabies vaccination process, and increase revenue through volume in the licensing process. To get there, we're recommending a modernization of the process, reaching a greater share of the population through advertising and outreach campaigns, and partnering more effectively with local veterinary clinics who haven't seen an update to their administrative incentives since the early 1990s, and they would benefit from a more efficient process to report rabies vaccinations and participate in licensed sales. Next slide, please. In terms of adoption fees, we are exploring a fee schedule that is variable based on a number of criteria, not just the age of animals. After this exploration, depending on findings, we could look at using revenue for higher demand animals to offset the cost of harder to place animals based on such criteria as age or breed or length of stay. Finally, our code revision adds clearer language and criteria for when the MCAS director should waive fees or reduce them via adoption specials. Such criteria include the use of adoption specials to help manage populations during peak seasons in order to reduce crises around kennel space. Next slide, please. In the code revision before you, we have elected to eliminate impound fees for lost or stray pets that are taken to the shelter. This was a practice used during COVID-19 and successfully facilitated pet and human family reunification and reduced undue hardship to pet redemption. This does not mean that we would not issue fines for significant or repeat code violations for multiple at-large or dangerous dog infractions. One suggestion that we may explore is to ask for voluntary donations to support the cost of care for found animals and have a more open and encouraging donation model, asking adopters or people licensing their pets if they would like to round up and make a donation to the shelter. And we have that technical ability in our payment system now. Next slide, please. During the review of our fee structure, in consultation with our county attorney, we noticed a number of fees that we could remove from code as they are obsolete or no longer a service provided. For example, we are not the licensing entity for animal rescues or facilities that house wild or exotic animals. At this time, we do not have the organizational capacity to offer low-cost euthanasia or cremation services to our community. Should that change in the future, we would consider updating the code and coming back before the board. Next slide, please. Thank you for your time and attention today and your ongoing support of Multnomah County Animal Services. We're happy to take any questions that you have.
Thank you so much. I really appreciate all of the work that went into this. I appreciate Commissioner Berman Edwards, you bringing this forward as a budget note. I'll say, do we have any public testimony on this item?
Yes, we have one person.
Okay, then if you guys wouldn't mind stepping back into the seats right behind you, and then we'll bring you back up for any board questions or comments.
Lightning.
Yes, my name is Lightning. I represent Lightning Super for the good of humanity, for all of humanity lab. One of the things on the fees that I kind of have a problem with is, number one, is that I do want to see the impound fees eliminated, number one, so I agree with you on that. Another issue I have is the licensing is predominantly the highest amount of income that these shelters do tend to make. And you're saying that we're having a participation problem on getting people to participate in the license program. What I would recommend is that we actually have a mobile vet that goes to doors and actually knocks on the doors and works with the neighborhood associations and just ask them, you know, we'd like to have your pet's licensed. We'd like to know how many pets you have. And again, on this study, was a number brought up on how many actual cats and or dogs, the total population in the city, in the county, in the state. I didn't hear that number. That's a very important number to have an understanding. Do we want to have certain stores selling pets out of their storefronts, or do we want to discontinue that? Do we have too many pets as far as not being able to take care of them, all of them, and they're ending up in these shelters because people just can't take care of them all? And when you have a euthanasia fee of $100, well, if somebody's having some serious problems out there, they might just say, I'm just going to abandon my pet. So that's why you have a lot of pets that are abandoned out there. And that shouldn't be happening. And remember, when they think the pet should be euthanized, that will be determined ultimately by the director and the professionals at the shelter eventually. So that pet can be saved, but we shouldn't have abandoned pets out there. And is there a reason for that? I think it's because of your euthanasia fee, and when people get desperate, they just abandon their pets. That should not be happening. The euthanasia fee should be eliminated, but let me say this. I want to make sure that we have a pet chaplain or an animal chaplain on all those decisions on euthanasia. I want them to have the communication with the volunteers before the euthanasia takes place. I want them to be in the middle of this and have discussions with the veterinarian. I want them to be in the room during the euthanasia. And the reason why I want that to happen, and as you know, suicide rates for the veterinarians are at what percentage? You should know this as Multnomah County Health Department. Some of the highest percentages, and Director Grayheck could substantiate that information through her research. We are trying to reduce the stress on the workers, the veterinarians, the animals. You need a full-time pet chaplain to be able to do that. Why you have not done that?
Thank you.
I hold you negligent.
All right, I want to invite Aaron and Margie back up, and we'll go to the board for any questions and comments, and we'll start with Commissioner Moyer.
With these fees, with the proposed fee changes, what changes over time do you anticipate regarding revenue from previously projected?
Yeah, let me take it the big picture. So there's licensing, which is the majority of the fees. And something we didn't say at the top is that our fees go into the general fund. So it's not anyway, I just want to make sure this is money going to the general fund. So fees are, as of last fiscal year, for just licensing was about $1 million. I think it was 800 dogs, $240K for cats. what we're trying to do is get that number up, and I can hand it off to Director Grayhack, who's looked into certain strategies to get that number up. The second largest contributor to revenue is adoptions. And we have working on strategies where we do less waivers and less sales. We've seen immediate returns on that, and we are expected to get our revenue much, we're projected, I can get you the exact number, but we're projecting much higher, bringing revenue in both this fiscal year and next fiscal year because of the changes already made to our adoption program. Do you want to talk a little bit about some of the strategies you've been thinking about and talking with to increase revenue on the certification side? Yeah.
Yeah, absolutely, thanks. And in terms of actual numbers, I'd want to do some of that work and get it back to you, Commissioner. But some of what we're looking at, when we initiated the convening of our Community Advisory Committee last year, we actually had a veterinarian on that group, and one of the things that she said is we have to figure out how to make participation easier, and I referenced that in the presentation a little bit. So we're looking at things like QR codes and how to really use technology, really elevate the technology to more current times and figure out how to help veterinarians participate in that. So that's one option. We're also looking at, there are some contracted companies who do licensing work, and we are exploring some of that work. It's a pretty good, as we look at the cost benefit analysis, it's a pretty good use of our money. We actually should increase revenue by looking at partnering with one of those organizations. They take it on, they do a whole chunk of it virtually. So we're looking at that sort of thing as well. So really looking at innovations that are far more current.
Great. On the impound fees, have we historically had people who it was a challenge for them to be reunited due to those fees?
We have, Commissioner. When we had those fees in place pre-COVID, it was a matter of someone would come in to, and it could be somebody's dog that bolted out the garage or during fireworks or any of those kinds of things on a hike, whatever, and the person comes to redeem their dog. And we literally, it was before I came to the shelter, but my staff told me stories that really resonated with me about someone coming in to redeem their pet and not having that fee, and literally staff coming through their pockets and purses to see, because we did have the ability to say, can you contribute something towards this redemption fee? And I had staff who were looking through their pockets and purses to put something on the table so that person could take their pet home with them. So we did have that.
And I'll just add to that we also did just an analysis, making sure we're clear between fines and fees, and fines in nature that are meant to be punitive. And we have quite a bit of those fines, especially for people who own or do not take care of their dangerous dogs. And then looking at, what are fees for? Well, they're for cost recovery. And our fees set up in a way that perhaps they're punitive, and we don't want that to happen, making sure that we're really distinguishing between those two. So that was another kind of philosophical reason. Now, if someone has a dangerous dog and we impound them, we can invoke a fee. That is a different situation than reunification.
Yeah. Okay, thank you.
Thank you, Commissioner. Commissioner Singleton.
Thank you, Chair. I want to just follow up a little bit on a question Commissioner Moyer asked. What is the timeline around implementing some of these changes to remove the barriers to online licensing?
Well, today there's a resolution in front of you on the impoundment fee, so that will go into effect if you vote on it. Were you a reference to compliance or the change in the fee structure?
No, I'm referencing the conversation that while you were presenting, and then some of the response to Commissioner Moyer about things to do with working with vets to actually increase the ability. You mentioned in the slides there's a barrier to online licensing where we saw a decline in people actually paying their licensing fees. So I'm trying to understand what the timeline is for implementing changes, because I appreciate that we want to do it, but if it's still hard for people to do, I feel like we've got to remove as many barriers as we can.
So ours, for example, working with companies who help with pet licensing, and I want to be really mindful because that's a potential procurement process, but we're actually engaged in a conversation and an exploration of what that could look like right now in partnership with our IT partners and an external vendor. And county finance.
Yeah, I would say within the next year.
Within the next year.
We're doing exploratory conversations, and obviously this conversation with you is very important today to make sure we're on the right track. After the resolution hopefully passes, then it will be we'll be in full implementation mode between now and next year.
Thank you. You mentioned as well, I think you're going to follow up with some data around the dollar amount. And then you mentioned, Director, that MCAS fees don't go back to MCAS, they go to general fund. And so I'll be interested to understand, I'm just curious if it doesn't make sense for us to have a conversation about restricting MCAS fees to MCAS, but not knowing the dollar amounts, what you get in general fund versus what you collect in fees, and what potential trade-offs might be. So getting some of those cost numbers, I think, will be really critical before we move into oh, I've summoned Christian.
Here comes the money
Long time no see.
Welcome.
I wore my matching glasses for yours. Good morning, Christian Elkin, County Budget Director. I use she, her pronouns. So the fees get transferred back to the general fund because when we do the forecast, we include all the fees that the county sets. So like if it's a county fee, it's budgeted in the general fund. The fees went, I want to say 2 or 3 years ago, we started to see kind of the recovery from COVID, and we were actually seeing that the fees were higher. So it's not that we're limiting them. Animal Services is $12 million of general fund. The fees are $1 million. They get credit for that. So it's not that we're taking them and spending them somewhere else. We just account for them in the general fund. They transfer back to the general fund.
Gotcha. Thank you. That's super helpful. And I think the last piece will be, I'll look forward to updates about fee waivers. I know that you're kind of on the cutting edge of this in multiple places within DCS, but I know it's a conversation to have countywide.
Countywide, and I think this is something that, unlike other areas of DCS, the current structure and code and policies does allow the animal shelter director, Director Grayheck, to waive those fees. What we'd like to do is do a policy in line similar to what we did for the land use department, where we have clear criteria for if and when we waive those fees. So that'll come across as a policy, and when we're done with that, we're happy to share it with you.
Perfect. Thank you so much. I appreciate all the work that went into this. And I know you mentioned it's not just you two, so thank you to the team who did this work, and thank you, Commissioner Brim Edwards, for bringing this forward.
Thank you. Commissioner Brim Edwards.
Thanks again for this. There were 2 slides that really stood out for me, the policy consideration slides, which is slide 6, and also 7. But in the policy consideration slides, I think it's not on the slide, but you actually talked about Calgary best practice, and they have a much higher participation rate. And it sounded like they have that because they promote the benefits of it. And just looking at this slide, the policy considerations, like the reunification that, at MCAS pets with ID, either microchip or license, are 3 times more likely to be returned to their owners, is to me a very compelling reason why somebody would do that. So thinking about, in addition to improving compliance, it's, I think, also selling why the benefits to the for those who have pets. The other issue that I'd love to have when you come back with sort of additional next steps in addition to what we're doing today is this issue of the rabies license. And I appreciate one of the policy considerations is that for public health, licensing is the primary tool for tracking rabies vaccine compliance. But the problem is when we only have a very small number of people actually complying with the pet license, that means we actually have a very small number of people that we have any idea whether or not that they have the rabies license. So it seems like low participation actually means we don't actually meet this really important public health goal. And we've had several conversations offline about this issue because I know when I get the letter saying your dog, we don't actually have a dog, we have our son's dog, but apparently it's our long-term dog. But when we get the letter saying that it's time to renew, and then it's like, oh, you have to have the proof of rabies vaccine, and usually that happened at some other time. It's in some other paper stack. If you've seen my office here, you can imagine I have paper stacks like that at home. And just the compliance issue, and I've talked to a couple of other people who are like, yes, we totally mean to do that. However, it's just like this matching the two things. So, whether it's working with veterinarians or others to somehow marry those up, because it doesn't seem like intentional non-compliance. It seems just like a more structural, it's been made difficult, not on purpose, but because of this other piece.
Agreed. I think you're not the only one, so I appreciate you sharing your personal story. We've heard those other stories. And for those not familiar with the issue, this is a state statute. So this is something where I think obviously there's very good intent around it and public health. I think that probably the indirect impact of the statute is by coupling the mandatory vaccine with registration, and creating a disincentive to register your pet. And so I think we've talked to government relations. I believe the GR, county GR over the years has kind of worked at this issue, but I hear what you're saying, Commissioner Brim-Edwards, that it probably takes a collective group of vets and other shelters to come together with state legislators to say, how can we continue to meet this public health goal and not create a disincentive to register pets?
And I just want to add to that. I think we actually tried to run a bill, like maybe not this past session, but the one before, to disconnect it for the rabies requirement for cats, because cats have extremely, is that right? Like extremely low.
Justin ran it.
Yeah, extremely low rabies rates. Like it's not such as issues. And even that got huge pushback in the legislature for that. So
I thought the study said that the rabies for cats is not in state statute, not required by state statute, but it is in our county code. That's what I thought I just read a minute ago.
I don't believe so, no, it's state statute. It's state statute. I'm sorry if I wasn't clear, and we've got Veronica here, but the rabies in particular is tied at the state statute level, not the code level.
I thought I just read that
You
was
just read? Okay.
county
Well,
code.
I will.
I'll go, literally, and that was just.
Okay, well, we'll follow. Cats may be separate.
We can go to Commissioner
Dogs and cats may be
Dixon.
separate. Dogs are clear, so we'll get back to you to make sure we're getting this right. And I know we've got attorneys in the room to make sure we're.
Said the commissioner's right.
Oh, okay.
He wrote that section.
Okay, we will get back to you on that to make sure we've got that clear.
yeah, and maybe it wasn't cats, but we did try to address this issue.
Try to address this issue, and we'll get back to you exactly the difference between cats and dogs and state statute and code.
So my other just question of curiosity, again, around rabies, because I understand what an important public health issue that is. When a vet provides a rabies vaccine and gives you that little metal tag, do they enter that into a registry? Because it seems like that's one way we would have actually a better idea to compare the gap between how many of those rabies vaccines happen in Multnomah County with the number of license.
That's the participation piece that I was talking about. So the veterinary responsibility at this point is to provide the pet owner with documentation of that. And they can also participate in our licensing program and send the rabies vaccination information to us, but it's not,
So there's not some statewide registry where they put it in? Okay, great. Thanks for letting me know. And then I just want to compliment the team on slide 7, where the recommendations that I think you came up with a strong set of recommendations. I really appreciate that. And I think this is an example of sometimes the natural inclination is we don't have enough resources to do what we need, so like increase fees, but I think in this case, taking a deeper look and a deeper study found there's some other things that can be done that are good for the animals and that actually will have some other very positive benefits to individuals who want to adopt or license or whose pets are lost. So I really appreciate the holistic look and not just that we took the time and didn't just go to naturally, we'll just increase the fees because that's how we do it. So I'm looking forward to what comes out in the budget process and any other recommendations that come forward that we can implement. Thank you.
Thank you, Commissioner. Commissioner Jones-Dixon.
Thank you, Chair. Thank you, Director Grayek and Director Bradway for being here as always. And I don't have any additional questions, just two comments. As a former funeral director, I just want to call out what Lightning mentioned as far as the chaplain, having one for MCAS. I know that's a policy or a budgetary conversation or operations conversation, so we can discuss that during our check-in. And then also wanted to mention just Anna and everyone else that has been coming in and providing testimony as far as the euthanasia policies and things. I know that's another thing that our office would like to check in with you about. And I'm here and available with my 18 years of serving families in the death care industry and just being intentional. I would love to be in that space with you as far as how to support and figure out how do we support the pets that are in our care and then and our vets as well. And folks
Yeah.
doing the work. So thank you.
Thank you very much, Commissioner. I appreciate the offer, and for everybody's knowledge, we do have a euthanization policy.
Yeah.
And I believe I've shared it with the board, happy to send it back out to the board. In the rounds of review, we make sure we follow that euthanization policy. Euthanasia and/or sick animals is not easy for anybody, volunteers and staff. This is really tough stuff, the hardest thing that we deal with at the shelter. And I really welcome any of your ideas on how to best navigate any kind of end-of-life issue, whether it's, pet or human. So I appreciate that. Thank you.
Yeah. I envision us bringing like Anna and others together so we can talk through that, but we'll talk about that after the meeting.
Okay. Thank you, Commissioner.
Yes. And I'm supportive of the resolution.
Thank you so much, Commissioner. All right, I appreciate this work, and sorry to confuse things a little bit with that cat thing, but I just wanted to share, this was something that we worked on because I think for us and our ability to have good compliance with licensing and making it as easy as possible for Multnomah County residents to adhere to what we're asking them to do, we were trying to do that, and I think it's a good chance to talk about what that work could look like in the next long session that's coming up, if that's a path we want to go down. So thank you again for all this work. Thank you again, Commissioner from Edwards, for this. I think updating kind of especially old, outdated, no longer applicable things is good, and I think it sets us up well to have a conversation about what these fees look like going forward to best support your work, but as well as the fees work that we're doing for other departments and divisions as well. So thank you all very much.
Before we just move off the topic, I just want to note, on page 22 of the study, it does say that Oregon state law couples the requirement to vaccinate dogs for rabies with the requirement to license dogs, that there's no similar state mandate for cats.
Okay, well, that's good, and so we can take that into consideration, I think, as we're looking at further updates that we may want to do on our county side then. So thank you, Commissioner. All right, Tasha, can we have a roll call vote?
Commissioner Moyer?
Aye.
Commissioner Singleton?
Yes.
Commissioner Burnham Edwards?
Aye.
Commissioner
Yes, thank you.
Chair Vega Peterson?
Aye, the resolution is adopted. Thank you all for your work, and thanks to everyone at MCAS for working on this.
R2, authorizing settlement of a workers' compensation claim for Danny Nguyen.
A motion? Okay, so I think folks had their mics off, but I heard Commissioner Singleton move and Commissioner Jones-Dixon second this. So we have approval of R2. And I think we have Amber?
Yes.
Thank you so much for being here this morning, Amber. I'll turn it over to you to talk about this item.
Okay. Good morning, Commissioners and Chair. I'm here to request approval for a workers' compensation claim for Danny Wen in the amount of $230,000. This does resolve all of the current and pending matters. There is dispute as to the current medical treatment and further issues going on. There's also a pending lawsuit, and this would resolve all of the pending and future costs on this claim.
Thank you so much. Tasha, did we have any public testimony on this?
Yes, Lightning.
Okay, great. Well, and so would you mind just stepping back, and then we'll bring you forward in case there are any questions for you.
Yes, my name is Lightning. The only question I have on this is any type of compensation claim, I want to have a clear understanding. It's either through the insurance company or it's through it would not be through the general fund, would be my understanding. But I want to make sure that's clear. That's the only question I have. Is it an insurance company paying this, or is it coming out of some type of a general fund payment? Thank you.
Thank you, appreciate that. Amber, you're welcome to come back up, and we'll go to the board for any questions. Commissioner Singleton, any questions?
No, thank you.
Commissioner Brim Edwards? No. Vince Jones, okay, sorry, Commissioner Jones-Dixon. And none from Commissioner Moyer. I also don't have any questions about that. So Tasha, can we have a roll call vote?
Commissioner Moyer?
Aye.
Commissioner Singleton?
Yes.
Commissioner Brim Edwards?
Yes.
Commissioner Jones-Dixon?
Yes.
Chair Viggy Peterson?
Aye, the settlement authorization is approved.
Thank you so much.
R3, budget modification number non-D-005-26, appropriate $200,000 of one-time only funding from preschool and early learning contingency to fund a true operating cost fiscal modeling tool.
May I have a motion?
Second?
Commissioner Jones-Dixon moves, Commissioner Brim Edwards seconds, approval of R3. So I'm going to be turning it over in a minute to Commissioners Moyer and Brim Edwards to introduce this, but I wanted to express my appreciation for the staff and leadership of DCHS and Pell. Some who are in the room today, so I wanted to make sure that we knew that they were here. I also wanted to thank the work for Districts 1 and 3 and their staff for all the work in bringing this item forward today. With that, I will turn it over to Commissioners Moyer and Brim Edwards.
Hey, thank you. I'll go first. Cool. Thank you. Today's Bud Mod is a follow-up from the briefing we had a couple of weeks ago related to looking at getting a true cost of care study, which is also a dynamic tool at the end of it, to help the county more accurately understand what it costs to deliver our Preschool for All program and have the ability to adjust various factors and see how that impacts cost over time. I want to thank Commissioner Brim Edwards for joining me in this budget modification. I think this is an important action for the board to communicate to the public the level of engagement and the seriousness in which we are taking our work of oversight of Preschool for All and our fiscal responsibility in ensuring the high-quality free preschool in Multnomah County, respecting the taxpayers who are contributing. What we will get with the true cost of care, I think, is a tool that both the TAG and the PEG brought up being incredibly helpful to the board in understanding this cost. Even yesterday when the TAG met, they discussed and I believe adopted a recommendation that the Board of County Commissioners do a true cost of care study. So this is very much in line with what the experts we pulled together are recommending. I want to thank the Preschool and Early Learning Department and Rachel Pearl for really jumping on this issue. This is something that my office has talked with them about for quite a while, and they have already, since our hearing, met with a consultant who does this work. I was made aware that they think they've identified internal budget or internal resources that could be used for this purpose, and so I will bring an amendment forward to designate that they will find those funds internally and not tap the contingency. So thank you for that. Thank you for finding resources. And then again, I think this board asking them to use those internal resources for this purpose, which it was not originally allocated, but thrilled that they were able to locate. Again, also thank our new director and staff at PEL for engaging in this conversation and really being able to talk about how we can use this tool to look at a variety of different options that may be of benefit to the program and to taxpayers. And then last, I just ask for board support on this budget modification as both a good step in furthering our understanding of the complexity of the Preschool for All program, but also as a symbol of the degree to which I think every commissioner is engaged in making sure that we are running the best, most accountable preschool program that is in the United States, and we should be really proud of the precedent that I think we're setting and the work we're doing to really hopefully dispel some perceptions that I don't think are accurate around this program. And then I just want to pass it over to Commissioner Brim Edwards and thank her for her partnership on this work and our shared commitment to really doing the difficult work of making the board engaged in this topic and on top of it. So thank you, Commissioner.
Great. Thank you, Commissioner Moyer, for the partnership on this. As I said when we had our initial briefing, I view this as part of the continuing evolution of universal preschool in Multnomah County. This study and hopefully a new tool will allow us to better assess, I think, better assess both the overall cost of the program, but also what individual providers, what the costs would be. So we know that all students have different needs, and sometimes there's cost associated with that, and this hopefully will, again, both for the providers, but also in the overall cost, we'll have additional tools. This is, as I said, I think this is more of like a continuing evolution of the program at the state level. For example, for the K-12 school system, you currently have a state school funding formula that over a long period of time has attempted to address some of the unique needs that either districts or students have and attach different weighted costs to those. And I think this will allow us to do this, but in a more dynamic way with the preschool program. And then finally, I think if we have this study with the more dynamic tool and you combine that with a fresh demographic study to understand what universal means in Multnomah County, we'll have a much better sense of the overall cost of the program, which will allow us to, I think, be better financial stewards and also better support the program. So again, I thank Commissioner Moyer for the partnership and bringing this forward.
I'd now like to have my Chief of Staff, Reagan Gray, kind of briefly present the BudMod and what is in it and the goals. But I really want to thank her and her role, not just in this BudMod, but really bringing her expertise on childcare to my office and helped, I think, me understand, what high quality, universal, free preschool can be, should be, how we should do it differently from our state partner, and just as a partner in really fighting for the children of Multnomah County. So I would like to thank Reagan and turn it over to her.
Thank you. Reagan Gray, Senior Staffer, Commissioner Moyer, she, her pronouns, and I'm really excited to present this budget modification, which will allocate money in order to contract with an organization that specializes in preschool and childcare cost modeling. The contract will generate a cost modeling tool for the purpose of setting rates and forecasting the expenditures for Preschool for All. The product will be a dynamic cost modeling tool. The tool can be used year after year. It can help determine rates and the overall provider contract awards based on the preschool's licensing type, location, child needs, hours of care, and so much more. It takes into account all expenses for operations, such as rent, wages and benefits, insurance, training, ratios, materials and supplies. It also allows the county to cost out policy changes that could increase or decrease expenses. So, for example, if the county chose to provide pooled health insurance to PFA teachers in order to lower the healthcare costs for the Preschool for All program, in the cost model, we could back out that expense when we're determining the rate and the overall contract award. I heard from Preschool and Early Learning that they've started conversations with a potential contractor to provide this true operating expense cost modeling tool. And it sounds like we can meet the quick time frame that would be needed to help you, the board, consider the TAG recommendations that will be presented to the board in April and contemplated in August. This budget modification will formalize the budget process through a board action by allocating the resources and setting the policy that guides the Preschool and Early Learning Division. It wasn't an expenditure that was previously anticipated in the FY26 budget process, so it is important for the board to formally approve funding and direction for the expenditure, just as you would have done had you anticipated this during the budget process. You know, there's actually much we can learn that Multnomah County can learn from the District of Columbia's free pre-K program that was passed by the DC Council in 2008. Implementation was behind schedule. Some providers and families felt feedback was not being addressed. Media was piling on to the scrutiny, and it seemed like DC's program was doomed for failure. And in 2010, the DC Council engaged with the program implementation by gathering feedback from providers and through policy sped up the implementation by 2 years. And now DC's free preschool program is serving 89% of 3 and 4-year-olds and is a national leader, driving a 67% increase in employment for mothers with young children. And I'm really excited about the board getting ready to dig in and make Multnomah County's Preschool for All be America's favorite free preschool program. I was listening to part of the TAG meeting yesterday, and the Technical Advisory Committee came to consensus on some of their recommendations, and they did vote to recommend that the board commission a true operating cost study in order to understand the full program implications of any of the tax changes. And this BudMod would deliver on that preliminary recommendation. And again, by voting on a BudMod, this would formalize that expenditure in the FY26 budget and really create a transparent process of how these resources are going to be spent and allocated. And I think it also communicates to the public that this board is making policy changes that respond to provider and family concerns. And again, this action is a step towards building America's favorite preschool program. Thank you.
Thank you so much. Really appreciate this, Reagan. So I know we'll probably have questions and sounds like possibly an amendment. So before we get to that, though, I'd like to see if there's any public testimony on this item, and we'll call you right back up.
Yes, we have one person signed up, Lightning.
Yes, my name is Lightning. I represent Lightning Super for the Good of Humanity, for All of Humanity Lab. Now, I do agree with the budget modification to better understand where the true operating costs are going and how they're going to be utilized. One of the concerns I have, and I'm hoping that when you do this research, is that we have such a high number of young children, kids that are homeless. And when you look at that, you say to yourself, well, how is the mother going to get a job? Well, this is obviously one of the ways, but we also have to take in consideration too, is that can the kids and the mother be provided actual housing through this program? Because they are homeless and they need to be provided housing at the same time. And you have projected, my understanding, for Universal for All somewhere around 7,500, or somewhere around 11,500 possibly, and the true numbers coming in around 7,500. And we have a surplus of money of 500 million sitting right now, possibly even more. And I think that what really needs to be focused on is the preschool for homeless children should be at the top of the list, and making sure that their families are also put into housing immediately, and allowing possibly one of the parents or two of the parents to be employed. As you noticed of the DC report, 67% of the mothers were able to get employment. That is huge. Look at that number, to be employed because of this program. And if we could do that in Multnomah County, look at the benefits to the families, to the children. But you have to get them in housing immediately through this program. And if they're homeless, why should that not be the top priority of this program on putting that family into housing immediately, paid by this program? And that's what I want to have the true operating costs of people doing that analysis, to see if that could be done and see if that's been done any other locations. Because that's imperative to the family, the parents being able to be employed, is to have that housing stability in their kids in preschool. You have the money sitting there, the policy should be put into place.
Thank you. Okay, Reagan, if you want to come back up, and we'll see if there's any questions. And as I mentioned, we have the department and division here as well. So I'll open it up for questions, and we'll start with Commissioner Brim-Edwards. Do you have any questions? Or?
You sounded unsure about that.
Well, I just didn't know if there was going to be an...
Skipping me to start.
Oh, did I?
No.
Oh, I didn't.
No,
I was.
right. You did R2.
Yes,
Sorry.
I did. I was like, Commissioner Singleton. I just wanted, I was actually checking to see if there was an amendment yet, or if we wanted to have some questions first. Okay. Questions? Okay, go for it.
Yeah, let's talk first.
Okay. Okay, great.
Of course I do.
Of course you don't. Okay.
But I will say, I just want to join Commissioner Moyer in thanking Reagan for the work you have done on this to bring it forward. And also the work with the division and the team at DCHS.
All All right, Commissioner Jones-Dixon.
Yeah, thank you, Chair. Thank you, Reagan, for bringing this forward, and Commissioner Moyer and Rem Edwards and staff as well for coming, so we can move it forward. So I'm thinking about Lightning's comments as far as how do we care for folks that are, our neighbors that are unhoused. And I continue to bring up our strategic plan and our Spark program and continuous improvement. We're on that mission as far as aligning all of the departments, just so you know, Lightning. So I think we're on the right track as far as building America's favorite county and ensuring that everyone gets connected to services. So thank you for always calling those things out. I'm supportive of the BudMod as it's written because it moves the work forward. So thank you again for bringing forth those recommendations, and I look forward to see what comes of it.
Great, thank you so much. Commissioner Moyer, do you have any? Okay, Commissioner Singleton now. Yes, or your chief of staff, All right, Commissioner Singleton.
Thank you. Thank you, commissioners, for bringing this forward. And I just have a couple of questions I want to check. One, last week, I think it was said that the timeline for implementation is 3 to 6 months. So I'm just curious about, I guess the intent would be, we would expect to see the remainder in the 27 budget proposal to make sure that this is fully implemented. And I know we can't talk a lot about 27 budget, but if this doesn't get done in FY26, we'll have to have some sort of rollover. Is that the...
Yeah, Commissioner Singleton and members of the commission, my understanding is that we could at least get a tool by the time that you're doing considerations in August. Really, the time frame has to do with how much we're asking of the contractor, and specifically the thing that takes the longest amount of time is the provider engagement. So what level of provider engagement and over what time frame. So there could also be a situation where maybe there's a preliminary cost modeling tool that is developed based on operating costs that they have put together and collected, and then you would have that for your considerations in August. And if there was a desire to continue the provider engagement more robustly than what happened before, before August, that could continue throughout. But it just depends how you build that contract and what all you want out of it.
Would it be helpful to have the department come up to speak to that?
Stay there.
Yeah, well, they have 4 seats. Good morning.
I almost fell off my chair. That would have been more fun. Good morning, everyone. Rachel Pearl, she, her pronouns, Interim Director for Department of County Human Services. So we've been talking to P5 Fiscal Strategies, which is the primary contractor who has done this work for the state, so has some baseline information already, which would make them an excellent choice in terms of moving forward with a true cost of care study, and they have incredible expertise related to this. So we've already been in conversation with them and had a meeting scheduled for last week already, and we did express sort of the time constraints related to the conversations that you all are having, and so they have given us a proposal that, based on sort of conversations, can be dialed in a bit more. Essentially, our expectation in our conversation to them was that this was done by June, and that there was some implementation support that they could offer beyond that that would potentially extend beyond that. And so that would be something that we need to think about if we go beyond June 30th with that contract. But again, the timeline and the cost right now in terms of developing this out has some flexibility depending on the level of, Reagan was speaking to this a bit, around the level of constituent engagement, provider engagement, which will be a critical part of this to ensure that we have an end result that we feel confident in. We are talking to them around, we did talk to them around the geographic difference for providers, so they will ultimately, what we have asked for, which would be most useful for the model that we have here in Multnomah County is site type and geographic location as it relates to one area, and these other components as well as we've mentioned insurance rates going up and down depending on what we're able to accomplish related to insurance. So having some ability to have a flexible, adaptable model as we move forward, which is one of the things I think that Deanna expressed when she came and talked about when they do a true cost of care study, but it doesn't have the ability to like change the model moving forward, then you have to continue to go back and do that again. So ending up with a tool that we can use will be incredibly helpful for us as we navigate some of the questions that are coming up in the TAG and the PAG related to sort of cost changes over time, whether that be related to inflation, rent costs, other things like that we can adjust. So I think it'll be really helpful.
Thank you. And then I think, Commissioner, this might be for you. You and I have talked a lot about the inclusion supports, and I think we heard some potential increased cost in that conversation, I think last week as well. Is that included in how you're thinking about the direction for what is included in this cost model?
Indirectly.
Okay.
Because it can't tell us what a policy change that we have not done yet, and therefore is not currently impacting the cost of care. But what it can do is we do actually know students with disabilities are in classrooms, and many providers have budgeted ways of supporting that child, which will show up in today's true cost of care. So yes and no. And maybe, do you want to respond as well?
Yeah, so what's different about our model as compared to some other models and related to funding? So seat cost is just a seat cost based on, what that costs for any child, and then we have what is inclusion supports. And I think that we can talk to them about, ensuring that the way in which we're navigating inclusion, and there's conversations I think that you all have had and that we are having as it relates to is there a general assumption that should be embedded within the rate cost that assumes that there will be children, a certain percentage of children in a classroom who are navigating disability or delay, and so ensuring that that there is a way to count for both, but we have a seat cost. We also have facility fund supports, we have startup funds, and we have inclusion supports that are outside of that seat cost. So I think it's important to remember that when we're hearing different information from providers, that we offer additional supports that other publicly funded seats don't provide outside of just the basic seat cost.
I just wanted to add that what this tool could do regarding our high needs population is you could adjust the cost of operating that classroom if you had lower ratios or an additional teacher, or maybe a teacher that had more expertise, that had a higher pay rate. So that would be something that would be in that cost model tool, or if there's additional material and supplies. Those are ways that it could be adjusted in there. The proposal that Commissioner Moyer is currently working on regarding high needs kids isn't about so much the cost inside the classroom. It is, how do we start identifying children that have high needs before they start school on day one? And the pilot project that she plans on bringing forward would be looking at how do we reach out to those families and find the kids that have high needs or have a disability and start meeting their needs, so that that can be built into the contract for that provider from day one. Right now, it's it lags. The kids show up on day one, those things start to be identified, and then we're changing the contract midterm.
Yeah, I thank you. I think the piece that I'm most concerned about is what I heard about needing different staffing ratios for classrooms that have a large number of students with high needs. Additional training and support around special ed came up in particular. And then I know that you all were updating some guidance around access, because it hasn't been super clear to providers about accessing mental health support. And so those are pieces that to me should be included when we're thinking about cost of care, and not that it needs to be, I don't care if it lives in the inclusion cost as opposed to the seat cost, but I'm not sure where we're going to get that information and those numbers from if we're not including it in this modeling.
We will certainly go back and talk about how that's possible. What I think is really important for you all to consider is it will be really, really difficult if we end up with a model that is a seat cost that's based on a child's need. Either way in which this is structured currently is that we have a seat cost and then we have additional supports based on what ends up happening in that classroom and the ratio of children that have documented delays or disabilities or other additional supports that they might need. That's from someone who is certified to make those declarations. And so that's important for the way in which contracts work at Multnomah County. In challenging when we're talking about like when our contracts are actually done per when we find out what children are actually enrolled in the classroom. So that's, our contracts are not done on a per child basis and based on child's needs. And so that's just an important distinction that I just want you all to continue to think about as you're making decisions or implementing ideas for us, or suggesting implementation ideas for us to put together, is that is not how contracting currently works. And we're continuing to have conversations to say, well, what would it look like if it did? And how can we navigate that if that's what's decided? But as it currently sits, it's really helpful to have seat cost that's based on current factors related to the structure of the actual program, and then additional supports that are based on the child's need.
I absolutely hear you. I think my struggle is if we're talking about staff to student ratios and they need to be higher in certain situations, that we need to be able to see that in this true cost of care model. And additionally, the staff training I think is in here as well. And if there's particular training that's needed, I don't think it should be targeted to classrooms that just have a child with special needs, right? So that should be included. So that's some of what I want to make sure is included in this conversation, so that when we see the model, even if we have the ability and it's dynamic and it toggles up and down, that need is included in the true cost of care, if that's helpful.
I'd just like to add, the state uses this true cost of care model, and they use it for their contracted slot preschool programs, and they do take into account high needs. So there is a way to do it. Maybe working with what are our contracting requirements, maybe there's a baseline true cost of care, and then maybe there's like a rider true cost of care that takes into account those things that would add the additional teacher, the training, the lower ratios, those kind of pieces. And again, that is the beauty of this product, is that it is so flexible and dynamic and can really meet the needs that we have and meet the county where we are and our contracting constraints.
Great, thank you.
Okay, thank you. I think I got everybody. I appreciate all the work on this. I will say, I appreciated that you were bringing up the Washington, D.C. model, because one of the things that was really a gift for us as we were working on Preschool for All in 2018 and 19 and 20 is that at the same time, Miriam Calderon was the director of the state of Oregon's early learning system at that time, who had also during 2009 to 2011 been the director of early learning programs in DC. And so we had some really good learnings from that program, and actually some of the things that she said they wish they had done differently, or like that they had learned and had to do some they had to do some resets on that. One of those was like the real importance of the infant and toddler care in terms of creating, keeping a system whole. So we were able to benefit from that as well. And so I think that's because that was one of the models and one of the places where they had the universal care. I think that was all the questions I had, and then I'll turn it over to Commissioner Moyer.
Yes. Thank you, Christian, for the language. I would like to propose amending the budget modification R3 from transferring $200,000 of funding from contingency to requesting that DCHS identify funding within their existing PEL allocation to fund this study. With these changes, the budget modification will remain budget neutral and reallocate existing department funds for the specific purpose of the study.
Thank you, Commissioner Moyer. Do we have a second?
Second.
All right, we have a motion and a second on the table for an amendment to this budget modification. Is there any discussion on this? No? Okay.
I'd like to thank the department
Okay.
for that. Thank you, and I really appreciate the level of coordination and work on this. It's been a good partnership, and I really appreciate all you're doing.
Yeah, and I would just want to thank you, Commissioner Moyer, for this. I think this really makes sense with the work that's happening and especially the partnership and leadership that you guys have been doing on this and working with the departments and the work that they have taken on around this. I appreciate the departments being responsive to what they're hearing from this board and looking at this type of work. So just appreciate the way that we've come together on this. All right. Tasia, can we have a roll call? Oh, Jenny, were you going to say something?
We'll have to vote on the amendment first.
That's exactly what I was going to do. Yes, thanks for making sure. Yeah, so Tasia, can we have a roll call vote on the amendment?
Commissioner Moyer?
Aye.
Commissioner Singleton?
Yes.
Commissioner Berm Edwards?
Yes.
Commissioner Jones-Dixon?
Yes.
Chair Baker Peterson?
Aye, the amendment passes. All right, thank you. So now we.
First meeting?
Yeah, I know.
We're not done, that was just the amendment.
Yes. So now, yes.
You're like, we can still leave.
So now we can have, see if there's any further discussion on the underlying budget amendment as amended. Okay, can we have a roll call vote?
Commissioner Moyer?
Sorry, Commissioner, did you?
I can ask offline. No.
Okay, are you sure?
Yeah.
All right.
Commissioner Moyer?
Yes.
Commissioner Singleton?
Yes.
Commissioner Berm Edwards?
Yes.
Commissioner Jones-Dixon?
Yes.
Chair Baker Peterson?
Yes, the budget modification as amended is approved. All right, thank you so much. That concludes our regular agenda for today. So now is when we have time for board comments on non-agenda items. I'll open it up to commissioners to see if who has anything to share. Commissioner Singleton, I always look at you. This is the area where I will never skip you.
Just to share another just brief update from PIRC reporting from January 21st to February 1st, there were 9 detainments in Multnomah County, bringing the total known detainments to 79 in the month of January. I want to just uplift that it was really powerful and heartening to see the thousands and thousands of people who showed up last Saturday for the labor-led protest. And seeing footage of how Multnomah County gathered was just another opportunity to find that joy in community in the face of this authoritarian regime and how they are showing up with their federal law enforcement. Obviously, I think it goes without saying that this march did not deserve the violent response that it received and excessive force from the federal agents, and I want to appreciate everybody for really making sure that folks stayed safe as they were dealing with that, as we were all dealing with the aftermath of that. Also just want to appreciate those who were there and got documentation and in touch with our local leaders and the ACLU so that issue can be dealt with. I mentioned this Tuesday a bit, but I wanted to reiterate that I think it's critical that we have a conversation about our current IGA with the City of Portland, and I'll be bringing that forward as a board conversation to really discuss what I think is now an outdated dynamic between City of Portland and Multnomah County. I firmly believe it's time to move past just this one compact with one city and look at a multi-city compact that addresses the intersections that we have where our cities are dealing with public space management, and affordable housing development, and the county is the social service provider. I think it's time for us to have a conversation about how we ensure people get out of public space management interventions into services, and then out of services and back into the affordable housing in their community. This is, I think I mentioned the trading money back and forth, the potential of the City of Portland not showing up with funds this year. We've continued, and again, being in this work for 2 decades in Portland now, having the same conversation about the smallest part of our homeless services continuum. I really think it's time for us to move past these discussions just about shelter, just about tents and tarps, and to have actual policy conversations about how we change the dynamics for people who are working to get out of homelessness and move back into housing and/or recovery. So I will bring that forward for a discussion for us to have as a board, and look forward to talking more with you all about it. Thank you.
Thank you. Commissioner Moyer.
As we all know, the Oregon legislature is in session and got their revenue forecast yesterday. I think it was good fortune for this existing biennium, obvious concerns about the future. And if it were not for the big, beautiful bill, Oregon would not need to be looking at budget cuts. But unfortunately, even with this increased revenue forecast, the legislature will need to close a $700 million hole caused to us by Congress, largely in the form of reduced federal support for Medicaid. And there are some really, really difficult policy choices in front of the legislature. And I want to talk about one that I don't believe the Department of Human Services, Oregon Department of Human Services, put up lightly, but is truly devastating to families if it were to be adopted, and it is to begin or to end a practice of disregarding parental income when it comes to the eligibility of children with profound complex medical needs and extreme behavior supports. This is not a large number. It is literally, I think, less than 500 families statewide. But the needs of these children, in order to remain in their family home, are often 24/7. This is a level of support that no family plans for or has the ability to absorb. And it is more than just covering the cost. It is the case management, it is the network of supports, it is the troubleshooting, it is the care team that these services provide. And I try to be hesitant to ask other bodies who have to make tough cuts to prioritize my priorities, but I will on many things. But this is one that does not, yes, there are certainly families in Multnomah County, there are families statewide impacted by this, but this is such a small group of people, and there's situations are sometimes all-consuming that they are the least able to advocate in Salem around a cut like this, but it would be utterly devastating to these families. And so I lift it up to the degree that I can, because we have got to be there for our neighbors. And there are situations that people cannot get through without help. And this is a situation where I feel like if you walked a day in these families' shoes, you would never put this on the table. And I'm not blaming DHS. I think it's one of the few areas they're legally allowed to cut. I don't for a moment believe they want to do this, but I lift that up because I know that this is such a small population and does not have the voices of other groups.
Thank you so much, Commissioner Moyer. Anyone else have things to share? Commissioner Brum-Edwards.
I do. Two things. I just want to call attention to a positive event happening in our community for the next week, February 6th to the 14th, the Winter Lights Festival. While Commissioner Moyer's district has sort of the is kind of the epicenter of it with downtown and the Central East Side. There also are this year some in District 3 and on the east side. Also historic Park Rose is having a Winter Lights kickoff Friday night from 6 to 8 at Park Rose Hardware. So I'm really glad to see this sort of spreading throughout the county. I know that individuals who went last year with their families or friends or neighbors found it to be in sort of these dark winter months a great way to enjoy downtown and get outside and really enjoy our community. So I just want to call attention to that. Then I also want to just thank publicly Deputy Nicole Boucher and Sergeant Roldan with the Court Services, Multnomah County Sheriff's Court Services, for the tour they gave me yesterday of the courthouse, kind of the behind-the-scenes tours about how they, in their work, keep the public, jurors, judges, and justice-involved individuals safe, and also some of their staffing issues that they have there. It also, I had an opportunity to, they took me through the legal center there, which is something that Judge Nan Waller really pushed over a number of years. And I'm trying to think about ways in which we could promote this, because it's really a place where individuals who, especially with civil cases where they may not have an attorney, actually have access to a lot of resources that can help them sort of navigate what for non-lawyers is a complicated system sometimes. But it's a great system. There are interpreters, there's lots of resources, people can print things out, research cases, and it was something that I didn't know about that seems like something we should be sharing more broadly. But I really appreciate the tour that I got yesterday, because it gave me some new insights into just something that I don't think as a commissioner or generally the public would actually see, but is absolutely necessary for our judicial system. Thanks.
Thank you. Thank you. Commissioner Jones-Dixon.
Yeah, great. Thank you. Thank you, Chair. Just reminders, Black History Month. Yesterday we did the proclamations, which were, it was grounding, to say the least. So I just want to say thank you to my colleagues and Commissioner Singleton and staff, Salome, and everyone out in Akemi and everyone that helped to put that together. Also wanted to just give a shout out to just all the events that are happening this month, but specifically the library department. They're the Soul Sisters, the Steppers. They're going to be at the Rockwood Library, I think, this weekend, and then I think they're going to be in North Portland. If you haven't participated, you should. If you want to get a good cardio workout in and listen to great music, highly recommend that. But also there's a long list of activities just highlighting the contributions of just African Americans and here in the United States. So I just want to again say thank you to the team that put all that together. And then lastly, just want to say thank you to the DCS team. So Margie and Sarah for just highlighting, putting together the highlights around the 257th project. We had an opportunity to sit with about 40 students from Reynolds High School, and we were able to walk them through just the impacts of the project, and they're going to participate in an event with us next week highlighting that. And they had a ton of questions around how we work, how we do the work, and then also recommendations around preschool for all and social services and youth violence prevention work. So just want to say thank you again to everybody. We're continuing to build America's favorite county. Thanks.
Thank you, Commissioner. Okay, so I have just a couple of things. One is I was down in Salem yesterday, and I'll share a little bit about that, but I did want to thank Vice Chair Jones-Dixon for handling the proclamations work, and I want to thank you and Commissioner Singleton for organizing all of that. I was sorry to miss it, but I think it's so important that we continue to honor and uplift all of the amazing work that's happening and the noting some of the commemorative centennials that are happening, as well as the county continuing to do our Black History and Future Month proclamation. There are great events that are happening. I think some organizations have been sharing those, so I encourage everyone to take part in those during this month. This Saturday morning from 10:30 to noon, I'm holding a virtual town hall open to the public around budget priorities. So this is something that I started when I became chair. In terms of having a town hall as I work on the executive budget, which is going to be released on April 16th. Information can be found on my website and social media about how you can register for the town hall. So we had great turnout in past years, and looking forward to a good discussion and information sharing on Saturday. I also wanted to remind folks that the Multnomah County Sanctuary Fund grant program for community organizations not currently contracted with the county is open until February 18th. The details about that grant can be found at maltco.us/federal. That's maltco.us/federal. And then, finally, just to touch base on my visit to Salem, it felt like a bit of the roll of the dice to go down and visit the day that the revenue forecast was coming out, but it actually, because it was up, it was good. It was good. Yeah, it was good. I was able to meet mainly with legislative leadership on the county's priorities, especially the areas that are so important for not to have cuts, because these are shared systems where the work and the funding and the partnership is so important. Behavioral health, homelessness and housing, community corrections, talking about the work that we've done around immigrants and refugees, and the desire to see work on that, and then also talking about economic opportunity and work around that, workforce and others. So it was a series of good meetings. I think people are know that there's going to be hard times even ahead in the next sessions, but really stressed how important it is for good communication and working together as we're thinking about the impacts to all of our jurisdictions that have for not just the people of Multnomah County, but folks throughout Oregon. So just wanted to share that update. I know that there are other visits happening from this board, and I think that our continued presence down in the legislative session will be really important. So thanks, everyone. That concludes today's regular board meeting. There being no further business, we are adjourned.